and tears them apart.
When the joints are damaged completely, you want them to have surgical interventions, various surgical procedures to restore the joint function, or even if not to restore it fully, but to make it functional and reduce the pain.
Hip replacement is a surgical procedure whereby the infected cartilage and bone is surgically replaced with an artificial one. Cecilia now needs to undergo surgery to correct both legs.
I need surgery. I need to have both of them done. Otherwise, maybe in the next about maybe 6, I don't know. They didn't give me a time, but I could end up on a wheelchair. I could get confined to a wheelchair.
The surgery can correct the legs as much as possible. Maybe not up to normal, but you can restore it anatomically to an anatomical functional position so that it can become straight. Then the patient will have to go a lot of rehabilitation through occupational therapy and physiotherapy. And if you combine those, I can say yes, the patient will be able to go back to a normal life and a reasonable functional capacity.
Worn-out knees can also be replaced by surgery. The kneecap is removed and the damaged portion is shaved off. A metal is implanted to replace the damaged parts.
This cement over the years wears off. So, and it's recommended that after 10 years, you need to replace the bone, the joint.
But the cost of maintaining the disease is way too expensive for many patients. Most of them have no choice but rely on painkillers.
This disease it's expensive because when you go to a doctor, it's like you have to go for radiograph. You're told to go for exercises.
Many patients do not go to see the doctor because they know they'll pay the consultation, but they will not have the money for the tests. They will not have the money for the drugs. They will not have money for physiotherapy.
Experts say that treatment of the disease has been changing with the challenges.
One infusion costs about 200,000, so it costs about $500,000 per year. But it sounds expensive, but it is cheap because the other tablet the patient has to take every day for the whole year. This one you get 2 injections for the whole year.
The doctors have to see their patients on daily basis for regular checkups, recommending appropriate medication and physiotherapy. It is indeed a daunting task.
We do not have rheumatologists in Kenya. We are only 2 at the moment, and we are overwhelmed because even if we are to receive all the referrals, we are not able to cope. But we are trying to encourage younger physicians to take up this. And I'm sure within the next 2-3 years, we will have maybe 4 or 5 rheumatologists.
The risk of developing other diseases like heart infections, diabetes, stroke, infections, and gut problems is high.
So you want to monitor those ones. You want to monitor infections. You want to see that they are vaccinated, for example, against influenza. They are vaccinated against pneumococcus, pneumonia. That you have a low threshold for looking for TB and treat it, because those are the things that can cause death in these patients.
A healthy diet with emphasis on fruits, vegetables, and whole grains help to control weight. Patients are advised to keep active. Exercise is a therapy that helps to reduce pain and improve joint functions. This is done to boost muscle strength and sustain basic health. Rose has to spare 45 minutes daily to meet this very important requirement. The pain aside, patients also have to deal with the never-ending problem of stigma.
The idea that you're not getting better, the idea that there's no cure, does not motivate society to give you the support you need.
People want to know how come you're walking like this? What happened to you?
You want something, you have to really beg for it.
It's not sympathy that I need. What I need is moral support and opportunity. Let me do to a certain degree that I'm able to do. Then that I'm not able to do, that can be given to me, someone else can do.
I'm not independent. I'd really like to be independent. So it's really put me down. But my family has always been there for me.
If I go down, she'll go down. So I have to be strong.
In every 5 people living with rheumatoid arthritis, 3 are women. For every 10 people suffering, 2 have a relatively mild form of the disease. It is estimated that 1 in 10 patients become severely disabled. The remaining 7 of 10 vary in degrees of difficulties and disability.
One of the reasons why I joined the University of Nairobi was to make sure that the doctors who are graduating from the University of Nairobi are able to make a diagnosis of rheumatoid arthritis and are able to make early referrals to somebody who can put the patients on reasonable treatment.
Perhaps to create more awareness and leave a legacy, Rose has already written her autobiography. At the moment, she's busy finalizing a book on how to live, cope and manage the disease.
If it ever gets published and gets sold, there are very many people who will read it and realize that you cannot, though God created us with both arms, legs and everything, it doesn't mean that you'll have those legs and hands for the rest of your life. This is to let other people understand that don't take your legs and hands for granted and make the best use of them in the best way that God wants us to use them.
That book, she hopes, will help countless patients out there who are keeping the battle for life alive.
The government recognizes AIDS. Everywhere you go, it's AIDS. The posters are AIDS. Everywhere AIDS. But nobody knows about us. So the government doesn't support us. The drugs are very expensive. The doctors are only 2. So we really have not been catered for.
That recognition may be long in coming, but it is a battle many of them are ready to fight to the bone.